to Many Talk, the podcast where we explore how mental health professionals are not just healing minds, they are reshaping modern healthcare in minutes. I'm your host, Miyuki Joy, a psychologist and advocate for integrating emotional and mental wellness into every layer of patient care. And now, for today's episode, we have your role as psychologist in modern healthcare. Whether you're a student, a practitioner, or just curious, we will unpack how psychologists are now central to diagnosis, prevention, and treatment, and how your role can literally save lives. Let's start at the beginning. Diagnosis. Modern healthcare is not just about physical symptoms anymore. Often, patients show up with headaches, insomnia, even chest pain. And after all the tests come back clean, doctors are left scratching their heads. That's where we come in. Psychologists are trained to see the invisible. We conduct clinical interviews, assess behaviors, and reveal the psychological roots of physical suffering like anxiety, depression, and trauma. In fact, the American Psychological Association reports that up to 70% of primary care visits are driven by psychological or behavioral factors. We connect the dots when biology alone cannot. Moving on, let's talk prevention. Because psychology isn't just reactive, it's proactive. Unhealthy behaviors like smoking, stress eating, substance misuse contribute massively to chronic illnesses like diabetes, heart disease, and hypertension. Psychologists step in early. We coach behavioral change, reduce stress, and build coping skills. We run wellness workshops, support groups, and community education sessions. Indeed, prevention works. The Center for Disease Control and Prevention notes that behavior-focused intervention significantly reduce hospital admissions for chronic conditions. Finally, psychologists are also front and center in treatment, and not just for mental illness. Therapies like cognitive behavioral therapy and acceptance commitment therapy help people cope with chronic pain, cancer, insomnia, and more. In integrated care teams, we work alongside doctors and nurses, managing stress, helping patients accept their diagnosis, and improving quality of life. We don't treat a diagnosis. We treat a whole human being. And in every treatment room, we restore what's often lost: hope, dignity, belief in recovery. So, if you have ever wondered if what you do as a psychologist really matters, I am here to remind you. You are essential. You are the voice of empathy in a noisy system. You are the bridge between what hurts and what heals, and you serve the light when it was all darkness. You change lives. You save lives. If this episode sparked something in you, share it with a friend or colleague. And before we finally conclude, here is a question to reflect on our topic for today. What would healthcare look like if a psychologist was part of every treatment team? I love to hear your thoughts. Reach out on our social media or leave a comment below wherever you're listening. Until next time, take care and keep leading with empathy. You have just spent 412 seconds investing in what truly matters. Again, this is your host Miyuki Joy. Be the best version of yourself. See you next time!